Tonight, a fascinating but still experimental way to treat severe depression with electrodes surgically implanted in the brain run by a battery pack. Now, neurologists say they're not sure how or why it works, but one woman who struggled with major depression for decades says it saved her life, and that after trying everything else, including shock treatment, she now has the capacity to feel joy. Dr. Sanjay Gupta has the story.
For as long as Edie Guyton can remember, she could not get the sad thoughts out of her head.
I mean, my mother used to say to me, "Smile, Edie, why don't you smile?" And I would, you know, give up something like that maybe, or just think, what is there to smile about?
At 19, the first of 3 suicide attempts.
For reasons that are inexplicable to me, even now. Got up and started playing with a razor. And
you cut your wrists. You cut both your wrists?
Yeah.
Over the next 40 years, she tried counseling, psychiatric drugs, and electroconvulsive shock therapy. But nothing worked.
The despair, I think, is what is the most powerful push towards suicide. Because there feels like there is no hope.
But if you could look inside Edie Guyton's head today, this is what you'd see. 2 electrodes, the thickness of angel hair pasta, powered by a battery pack under her collarbone.
I don't think about it, but I have electrodes in my brain.
It's an experimental use of deep brain stimulation.
So what are we looking at here?
Pioneered by neurologist Dr. Helen Mayberg.
The X is where we're stimulating.
The target is called Area 25, a junction box for the brain circuits that control our moods.
Here at Emory, where I'm on staff, my colleagues have been using deep brain stimulation for more than 15 years to treat movement disorders such as Parkinson's disease. In that case, they're targeting the brain's motor system. But Dr. Mayberg wanted to use DBS to target Area 25 for patients with severe depression.
It was a procedure just like this done on Edie Guyton. In surgery, patients are lightly sedated as a neurosurgeon drills 2 holes. With an instrument to guide him, he then inserts the electrodes.
Is the contact on? Contact's on.
As a benchmark, the doctors asked Edie to rate her feelings on a scale of 1 to 10, starting with dread.
What?
My sense of dread is getting worse.
Your sense of dread is getting worse. Rate it.
2 minutes later, they turned on one of the 4 contacts.
How does it feel right now? Is it still high?
Not much less.
What's the dread right now?
3. A drop from 8 to 3. But doctors would soon get an even better result.
They're going to make some changes.
Up until this time, Edie could not connect emotionally, not even with her baby grandniece, Susan.
And somebody handed her to me, and I held her, but I was going through the motions, and I felt really nothing.
Nothing.
Nothing. Nothing.
That changed in the operating room.
On, stim on.
When they tried contact number 2.
Just let me know if anything changes. Just give a shout.
I just almost smiled.
You just almost smiled?
Yeah.
Describe that for us, would you please?
I haven't smiled for like a long time. Or a laugh. Right there in the middle of brain surgery, I felt feelings that I thought were gone.
When you say you almost smiled, did something strike you as funny, or is it just sort of spontaneous?
It was, well, I was thinking of playing with Susan. I started thinking about Susan, little Susan. And I thought I was holding her with her face to me.
What was that like, just to think that a machine and electricity could transform your emotions like that?
It felt fantastic. I didn't care what was doing it. It just felt great.
Sanjay joins me now. Sanjay, this is incredible. I mean, do we know how this works?
We don't. And it's one of those things in medicine where I'll tell you some of the original research was first trying to figure out, is there a seat of depression in the brain? A big first step. You see some images, Anderson, where you'll find this area 25. That's the area that it's called. That bright green spot. They think that's where depression lives in the brain, but they didn't exactly know what to do about that. So that's why they decided to simply stimulate that area with the deep brain stimulation. Now, Anderson, I don't know if you could see this. Let me show you this really quickly. This is basically a power pack, a battery pack. It sits underneath someone's clavicle, Edie Guyton's clavicle, right here. And then this little probe here is what actually goes into the brain. Goes in on either side, but that's what she has inside of her right now. This was done a few years ago, but you saw how well she's been doing.
How often does it stimulate?
Well, that can be changed. There's settings that you put on there. There's 4 different leads on there, and you can actually program it to stimulate not only how often, but how much at these different leads. And they play with that. They say, well, we turned on lead 2, we didn't get much of a response. Let's turn on lead 1, a little bit higher electricity. So it's a little bit of trial and error once they get in there, but they find the right formula, as they did in Edie's case.
Is it always this successful, and can anyone have this procedure done right now, or is it all experimental?
Well, so I've been following the story along for some time. They first started this in Toronto several years ago, and now they've done about 37 patients total. If you look at the data sort of across the board, about 2/3 of patients got better. And let me preface that by saying these patients, Anderson, were patients who had no other options. That's what qualified them to be in the trial. Meds hadn't worked, even things like electroconvulsive therapy had limited benefit. I mean, they were really out of options. So these were the worst of the worst patients. 2/3 of them got better. There were a few that did not get better at all, but there were really no significant side effects. There was a couple patients had wound infections, but they were trying to figure out, is this safe? And it appears to be.
But at this point, it's still experimental.
Yeah, right. Yeah. So at this point, I think it's a few years before we get possible FDA approval for wider use of this sort of thing. Right now, it's just 37 patients still in clinical trials. As you know, that can take a while. But look, I mean, that was pretty remarkable what you saw there. And they're also looking at using deep brain stimulation for things like OCD, possibly anxiety, these types of disorders that were sort of thought of as mood disorders, psychiatric disorders, possibly treated this way in the future.
It's incredible. Sanjay, appreciate it. You can see more on Sanjay's report. Battery-powered brains, a new treatment for depression, Saturday and Sunday, 7:30 a.m. Eastern on Sanjay Gupta, MD. Also, don't miss Sanjay's full report on CNN Presents, Sunday night at 8 and 11 Eastern.